Welcome to AMG Weight Loss. This is Dr. Eric Ibebu. It's exciting to be one of the endobariatric centers in America that offer non-surgical weight loss. So today I wanted to talk to you about what I call our 4 horsemen, the four key procedures that I offer today that's above and beyond many other things that I do offer. And number one, we're going to talk about today is a procedure called endoscopic sleeve gastroplasty. ESG, as we like to call it, is a non-surgical, minimally invasive procedure that is accomplished endoscopically. Many of us will describe it as the non-surgical version of the gastric sleeve. Of course, gastric sleeve is surgery, but ESG is an endoscopic procedure. It involves suturing the stomach to make it smaller so that we create what we will call a sleeve effect without surgery. The key thing is, again, reducing the stomach volume. By so doing, we're able to reduce the amount of food that a patient can tolerate or can eat at any one particular time. So the advantages of ESG are many. Number one, it's non-surgical, so it doesn't involve any laparoscopy or any incisions from the outside. It's an outpatient procedure. It's done at our surgery center, and it, of course, is performed under anesthesia, so patients are comfortable. It takes about 45 minutes or so to perform. ESGs are also does not require hospitalization 99.99% of the time. As a matter of fact, in our experience, we've never had any of our patients that required hospitalization, but we do know that there are centers around the country that may hospitalize some patients. But the amazing thing about ESG is the ability of patients to return to work very quickly. Downtime is oftentimes 72 hours, maybe less, maybe more for a few patients. But the key thing is patients are able to get back to their normal lives, get back to work in a very, very quick or short time interval. As opposed to surgery, many times surgical downtime could be as short as 2 weeks or as long as 6 weeks, depends. With ESG, we typically do not see this. Also, patients are able to tolerate ESG very well. Nausea, vomiting can occur the first 48 hours or so. And of course, we use medicines to control those symptoms. The complication rate for ESG is also extremely low. In clinical trials, it's about 0.4% of patients will experience a complication that requires maybe hospitalization or requires further care. In the surgical series, it could be up to 30% complication rate for surgical sleeve gastrectomy. So that's a massive, massive difference. So our ESG patients also are able to, like I said, resume their physical activities very quickly. A lot of our patients go back to the gym within a week of their procedures. So these are just incredible things. And one of the questions I get often is, can I lift? Can I pick up my baby? Can I pick up my a box or something like that? And many times the answer is yes. Because there's no external incisions or external suturing, the likelihood that somebody will disrupt their intragastric suturing by lifting up a baby or a 20, 30-pound weight is extremely unlikely. So ESG is one of what I call our 4 horsemen. And then we're going to transition to yet another one of the 4, which is a procedure we call bariatric revision. Now, bariatric revision is unique. It is for that patient or for those patients that have had gastric bypass in the past or have had gastric sleeve in the past. Now, for many, many years, we had no option for those people because what we found is typically 5 years and upwards, 5 years, 10 years, as the case might be, most patients that have had surgical sleeve or have had gastric bypass will begin to pick the weight back up. And there are many reasons that this happens. But one of the main reasons that this happens is because your stomach begins to stretch. What we call the gastric pouch gets bigger. And for gastric bypass patients, their gastric outlet gets bigger. With endoscopic revision, we're able to suture this gastric pouch and the outlet to make it small again. These are non-surgical procedures accomplished with a device we call overstitch. It's an incredible, life-changing experience. Now we've performed hundreds of overstitch procedures, and I've seen patients that have come to us from all around the country, literally, and have regained the satiety that they lost. Because that's what happens. That's one of the signs that people that have had gastric bypass or sleeve will tell you. That initially, after their first surgery, it took a very small amount of food to make them feel full. But fast forward 10 years later, 8 years later, 7 years later, and for some patients, I've seen a patient 2 years later, they lost satiety. What does that mean? It means the ability to feel full is gone. It means that their stomach size has gotten bigger. And now with revision, we're able to adjust those things without exposing that patient to surgery again. This procedure is a very short procedure. It takes about 30 minutes. It's performed under anesthesia. And of course, our patient is able to return to work within 48 to 72 hours in our experience. And all of our patients do go home the same day. It requires medications for pain, requires medicines for nausea, vomiting, which is typical for the first 24 to 48 hours. So endoscopic bariatric revision is truly, truly changing life and giving those people that had lost hope that they had another option after they've had surgery, giving them brand new hope. And that's what we do here at AMG Weight Loss, bringing hope and bringing durable options to patients on a daily basis. Our third procedure that I'm going to talk about today, as a member of the Four Horsemen, as I like to call them, is a procedure we call obera. Obera has been FDA approved since 2016. We are one of the premier centers for obera around the country. And not to brag, but we've sincerely placed more balloons than most centers in the entire eastern coast of the United States of America. That's the truth. Obera is an intragastric balloon and it's done endoscopically. We place the balloon using an endoscope as a guide so we can see exactly what we're doing. When the balloon in the stomach, we inflate the balloon to the correct size and it creates satiety. It makes the patient feel full so they don't eat as much as they normally would and they lose weight. With the obera program, as with our other programs, there's 6 months of dietitian care where you're going to be retrained, where we're going to help you to understand what each calorie means, what each food choice means, and help you to make good long-term choices. The obera balloon has to be removed after 6 months. It's been FDA approved for people whose BMI are between 30 and 40. And after 6 months, the balloon is removed endoscopically. Takes about 10 minutes to do the removal. And again, patients go home the same day. So obera balloon is incredible. We've seen tremendous, tremendous results. I've had patients lose as much as 120 pounds with obera. So we do know that the balloon works perfectly well. However, now we have the latest kid on the block, or the fourth member of our Horsemen. And that is a balloon procedure as well. And another intragastric balloon that had been available in Europe for many years, but just got FDA approved in the United States early 2022. And the SPATS balloon is what I'm talking about. The SPATS balloon is the only adjustable balloon on the market today. Adjustable means we can make it bigger or we can make it smaller. And this is key because for some patients, after balloon placement, nausea and vomiting can be pretty intense. And for some people, they just cannot tolerate it. In the past, let's say 4 or 5 years ago, or when we first started to offer the obera balloon, I had a few patients who just could not tolerate the balloon. And within a week or two, in some cases, we had to go back and remove the balloon. That's obviously is not a good way to make an investment, of course. With the SPATS balloon, we are now able to adjust the volume of that balloon. So if a patient comes to me a week or so after the balloon placement and they're having intense nausea and vomiting and they cannot tolerate the balloon, what we'll do is repeat their endoscopy. And by grabbing a hold of the extension tube that comes with the SPATS balloon, we're able to reduce the volume of the balloon. And therefore, we're able to salvage that balloon and salvage the investment the patient has made in that balloon. And that is amazing. Another opportunity to adjust the balloon comes when a patient feels like their weight loss has stalled. So 3 months into the program, 4 months into the program, some people feel like they're no longer losing weight or the pace of weight loss has slowed down. We can repeat endoscopy and increase the volume of that balloon, therefore jumpstarting the weight loss process again. With all these programs that we offer, you work with our dietitian for 6 months. And of course, I have a lifetime commitment to you, but within the program, we have a 1-year commitment where you can see us as many times as you need to go over multiple options and to go over your progress or the lack thereof if it does happen. So at AMG Weight Loss, we are committed to non-surgical options for weight loss. And listen, we are looking forward to seeing you no matter where you're coming from, around the country or even from around the world. You're going to be welcomed by a team of caring, loving, expert professional people, and we are going to be the next best family that you have next to yours, hopefully. So thank you, and come see us soon.